Can melatonin lead to heart failure? Find out on this next episode of Digest This.
Welcome to Digest This, the show that helps you revolutionize your digestive health. Here are your hosts, Dr. Liz Cruz and Tina Nunziato.
Hello, and welcome to Digest This. I'm Dr. Liz Cruz, and I've got Tina Nunziato sitting right here by my side. Thank you so much for joining us. If you are one of our regular listeners, thank you a million times for being on this journey with us. If you are a new listener, we welcome you, and please check out our library. We've got over 600 episodes. We've been podcasting for, oh my goodness, over a decade. So a lot of great information. Let's talk about melatonin.
Melatonin, yeah. This was an interesting article because I know a lot of people on melatonin.
It's very common.
Yeah.
And honestly, I haven't even thought about melatonin because it's just become one of those things that you commonly see on someone's med list. Okay, it's considered a supplement. It's considered to be benign, no issues. Anyone can buy melatonin. I mean, you could give it to your kids.
Yeah, it's generally recognized as safe.
Yeah.
And actually, we were reading this article. It was talking about how 25% of the population is on melatonin.
That's a
which
lot.
is pretty high.
That's a lot.
One in four people is pretty high.
Yeah. For you 75% maybe that are not on it, maybe you haven't heard about it. I mean, let's talk about it because it's something that is everywhere. Like I already mentioned, you can buy it at any drugstore, any supermarkets. I mean, you could probably go into even like a gas station and find it there.
It comes in tablets. It comes in patches. It comes in gummies. It pretty much comes in all
Absolutely.
different forms.
It is probably one of the most common natural sleep aid out there to help you sleep. I mean, it basically, it's a hormone that we make in our brain, in the pineal gland. We make it. It helps with our wake-sleep cycle. It's a hormone that helps us sleep.
I learned something about it.
Yeah, go ahead.
So what it actually activates in the brain, in the gland, like you mentioned, when it starts to get dark out. So it's supposed to help with the balance of your circadian rhythm.
Right.
And so the hormone gets excreted when it gets dark and it binds with protein to help start winding you down.
That's awesome.
And light, the exposure to light actually does the opposite. So people who work night jobs, people who are like nurses and doctors who are working all night, or EMT people who are up all night, or there's a lot of people who work
that
night
travel.
Shift. Yes,
Yeah.
the night shift, or you're taking a long flight. Your rhythm can get off when you're not sleeping at night and up during the day, and even when you're on your screens at night. On you're watching television, you're on your phone, you're on a tablet. It's emitting the screen light. It does the opposite effect with melatonin. It's not going to make that melatonin come out like it should. And so a lot of people these days have a lot of issues sleeping, and I think it has a lot to do with screen time and television.
Absolutely.
But then we rely on these supplements to try to help the body, provide that hormone that it should be making on its own.
Right.
And then we're giving it to our kids, and because it's generally recognized as safe.
That's right.
But anyway, this study was very eye-opening.
Yeah, and so let's talk a little bit about the study. So this was actually presented at a scientific session at the American Heart Association. I guess they were having a convention. These medical societies, I mean, there's conventions going on all the time. And so it was actually presented at the session, the scientific session. The scientific sessions are usually part of these big medical conventions where people can come and present their research. And it doesn't have to be something that's been proven, but their hypothesis of something that they think could be beneficial. And so they come and they present their research. And from these, a lot of the medicines that we use, come from the research that is presented at these conventions. And so,
or further research is invested.
Further research, exactly.
Like somebody could present, like you said, maybe they didn't prove something, but they've proved it enough to where a research company's like, let's put more money into this.
Exactly. Yeah. And so this one was actually, I believe it was a study of medical records that was conducted from people in the US and in the UK. And what they were reviewing, so they weren't actually doing studies on people. They were actually reviewing medical records,
Yeah.
records of people who had been prescribed melatonin and had been on it for about a year. Okay. Now there are a lot of issues with this study because number one, these people were not being, from my understanding, it's not like they were talking to these patients to find out, were you using it every night? And who knows, like, who was buying it over the counter versus, I mean, these were just like,
Yeah, there could have been
prescription.
People,
Yeah.
There could have been people in the sample who didn't have melatonin on their chart, but they were buying it on the side.
Exactly.
Right? So these were just people that were prescribed melatonin,
Right.
had shown in their record that they'd been on it for over a year, and then they had these outcomes.
Exactly.
Right.
So the bottom line on it, well, there were a few bottom lines, but one of the things that came out of it was that they found that there was an increase of 89%, an 89% increase in the incidence of heart failure over the course of 5 years. In these charts, these medical records that were being looked at. So that's where, the actual title of this article that we read was they're being concerned about what we typically have considered to be a very safe, natural supplement. There's a concern that potentially in people that are taking it long term, so over a year, that there could be an increase in the incidence of heart failure.
Right.
Now, they didn't go into what exactly could cause that. They didn't go into any of that. But that was one of the things that came out of this analysis.
Yeah, and that they were that there was almost a 3.5 times likelihood to be hospitalized for heart failure when compared to those that didn't show that they had melatonin in their chart.
Right.
Basically.
And what they were defining, and I know that we've kind of already said this, but what they were defining as long-term would be people taking it over a year. In general, we know that melatonin can be taken in the short term, like for 2 to 3 months.
Right.
And so
to help reset the circadian rhythm.
Exactly.
The idea with it is to help reset your circadian rhythm, not to be taken long term. But a lot of people rely on these things to sleep every night.
Exactly.
And they're on it for multiple years, and that's what they were talking about. There hasn't been enough research to determine how that can affect the brain and the body and the heart.
Yeah, and we don't know what the story before that even led them to this analysis, or what even prompted them to even do it in the first place. But yes, I think there were no conclusions made from the study. I mean, this is just a review of medical records, so they can't really make any conclusions that would change our recommendations at this point in using melatonin. But what it does is just show that there really is a need for more robust long-term studies of this supplement that in general we have considered to be safe. I mean, to the point of it being used in children.
Right. There was another article that this article was linked to from Australia where there had been a handful of deaths from melatonin use in children because as a child you have to watch the dosage of the melatonin. I mean, typically no more than 5 milligrams a day is recommended for adults, but for children, especially young children, no more than 1 to 2 milligrams. So you have to be really careful with the amount you're giving them. But also, the other thing that I learned was that there's other things being put in these supplements, okay? Or there's extended release options with these supplements. And you have to be really careful and read the label and make sure there's not other things being put in the supplement that also could be causing issues, long-term.
That's right.
Side effects. It's scary. I mean,
it is scary. Yeah.
Because these things aren't being regulated by the FDA. I feel like as consumers, we just trust that if it's on the shelf, that it's safe.
Yeah.
And we don't know. That's a thing. Unless you know exactly how much is being put of what in this, it can be very scary.
Yeah, I really think that this is a wake-up call to just make us aware that, we take things thinking, oh my goodness, this is benign, this is nothing. You don't even think about that because, like Tina said, if it's over the counter and if it's there, we assume that it's something safe for us to be taking. And I think that we need to think twice and think about, why are we taking it? And it's just to create more awareness. This study was not making any claims, and we're not making any claims either. You can't make any claims from an analysis like this. Basically, they're just pointing something that they noticed in their analysis of these records that they were reviewing, and just making us aware, and also putting out there that there is probably a need for doing more long-term studies, because if there truly is a connection between long-term use of melatonin and heart failure, like that's major.
Yeah.
That's something significant. So, but at this point, they cannot say that. And so just be aware.
Yeah, and know that there's other things out there to do, like for your, we'll call it your sleep hygiene. That's a very kind of common term that people use. You know, trying to get to bed, you know, at a decent time at night, trying to put up any tech that you have an hour before you go to bed, like literally putting it away, even television. Try not to watch television an hour before you go to bed. And this goes for adults and children. Yeah. Trying to sleep in a cool, dark room that is quiet. That's also very, very important. It's hard to go to sleep if, you know, someone else in the room is watching TV or someone else in the room is doing something. So there's a lot of things that can affect someone's sleep hygiene. And it's important that if you are struggling with sleeping, maybe trying a more, you know, these other natural approaches before we jump into taking a supplement for something like that.
That's right. Yeah, very much. You know, and we're all guilty of these things. You know, I mean, we try our best with the sleep hygiene, but I mean, you know, I will look at my phone right before we go to bed, you know, and just do a little scrolling, like, oh, just a quick little scroll, you know. So it's something that we all do it, you know, or at least I think the majority of society does it. And it's something that we definitely need to be more aware of, and just, you know, to help our bodies.
Yeah.
All right. So if you want to connect with us, if you have any questions or you have any suggestions on topics, find us on our website, drlizcruz.com. There's a magenta colored button on the homepage that you can click and schedule a free 30-minute wellness consult. And that's free. It's our gift to you, and it's done over the phone. So anyone anywhere can do it. If you haven't subscribed, please subscribe so that you never miss an episode. If you haven't rated us, please rate us so that other people just like you can find us faster. And please give us a 5. And also, when you go on our website, sign up for our newsletter. And we try to get something out every couple weeks, and a lot of great information. So thank you so much for joining us, and we will catch you on the next podcast.
Thank you for joining Dr. Liz Cruz and Tina Nunziato. To learn more about their revolutionary products and services, go online to www.drlizcruz.com.